my email in before I do anything. So everybody, if you could do that while I'm doing it, I'd appreciate that. Okay. Put your email in the chat room. Okay. Well, while you're doing that, I'm going to get started. So my name is Mark Narcus Kramer, and I'd like to, some of you have known me from a previous pop-up about this subject. I happen to be the first catalyst because I'm proposing a project, and the purpose of this meeting is to actually discuss the project, even at its initial conception, which is the project the right project? Is it the book the right way to go? And so there's a lot to discuss. And at the end, I want to see if anybody's interested in joining the project, because what a catalyst does is he doesn't go off, or she doesn't go off and do everything by themselves. It's to bring people in a cohesive way. I've sent some preliminary information out to some of you, and so you're a little more aware than some others about what this is about. Let me start out with my own history. I am a system engineer. It seems like it's very far from management, but I joined a company called the MITRE Corporation, and when I joined it, it was the classic expert culture, which is, MIT graduates and physics graduates and, people who really thought they were brilliant. And maybe they were brilliant in their own dimension, but what we learned early on is that we were coming up with great ideas and nothing was being implemented. And, so our first reactions as being an arrogant company was, well, they're just so stupid, they don't understand who we are. And then we went into a crisis because after a while, since nothing was getting done, we were getting money directed from Congress to our country. They said, well, gee, if nothing's getting done, why don't we just phase you out? Nothing about like a crisis to really change your view. And we had a very extraordinary president who didn't say, hey, we're so smart, and they're so stupid. He said, something is wrong here. And what he did is he realized that this expert culture was killing us. And we went to what's called an outcome management structure, where we were engaged in thinking about what do we really want to happen. And in order to achieve that, we had to completely change the way we operated. We became collaborative. We brought in many different disciplines, because we could have a great engineering solution, but if the economics wasn't right, if the politics wasn't right, if the users didn't know about it or like it, nothing would happen. This is exactly why nothing happened. And so we actually transformed ourselves to an outcome organization, and without knowing it, we applied a lot of complexity management concepts. We became very collaborative. We focused on stakeholders. We focused on distributing power. So when I retired, I got involved in Plexus because I knew Lisa Kimball, and I said, oh my God, this is it. This is what we did, but we didn't know it. So I had this idea that I'd love to be able to share my story as an example and then relate them to Plexus ideas or complexity ideas. And so I had this idea for a book, which was to start with people's experiences. And I wrote a chapter on that as an example, which will be on a link. And that chapter explored how we actually evolved and the miraculous things that happened. For example, I had a project of 41 people, and 39 of them were doing great work. And I'm saying to myself, how did this happen? Well, part of it was in the collaborative process, I let people sort of choose where they wanted to be in the project rather than assigning them that. And as things evolved, I created a really open communication environment where people would come to me and say, this is the kind of things happening. And then all of a sudden we make quick switches. And so it was just an extraordinary experience, and it was a very highly motivating project. And so as I told the story, I realized, God, first you can tell the story, and then you can say, well, what are the principles that led to the story? And I thought stories would be really good because I think people really, they really connect with stories. And then the idea would be is within each story, people would say, what did they think the principles were that made this work, or why didn't it work? And then as all the authors would get together, we would finalize a chapter on whether there are commonalities across the stories. And then if we can do this, and this is the real question I'm not sure about in my own mind, is what I've noticed is a lot of the stories are all about very specific things, like in my case, it was getting a new technology in Alaska to save lives because there was a huge accident rate. Or in other cases, it's to save lives because of the infections in hospitals. Or in another case, it's to transform a school. But what about problems like global warming, about automation, about cybersecurity, things that have global impacts? How do these principles really apply to them, or do they don't? So the idea then would be each of us who would like to be part of this would write a story, then we'd all get together, we'd see if we have commonalities, and then we would explore the possibility of how do we apply these to larger problems, or that could be a separate thing. So one of the things I want to ask everybody is this a good idea? Or are we just, there's so many stories out there, does this really not make much sense? Though I was thinking it would be a Plexus book so that Plexus individuals could do it. Secondly, books are really hard. And they're really, Amanda made me think about maybe there are other ideas. Maybe we do it as a comic book or a visual presentation because books, I'm wondering how many people sit down and read books. But the idea would be if you are a member of Plexus and you were out trying to explain something to people, and you wanted stories and you wanted examples, et cetera, this would be it. So it'd be a Plexus tool as well as something for people else. So I am now going to be quiet for a while and get people to comment on what I've just said or ask questions and believe me, at the end, I'm going to ask you if you want to be involved. So think about that too. Okay. Can I get some comments? Okay, well, I'm going to ask somebody. Howard.
Hello.
Howard, you got to unmute.
I'm now unmuted, I think.
Hi.
Hi. Excuse my speech. I'm recovering from an illness that has affected the clarity of my speech, so sorry. So
it's okay.
I am the perpetrator of outcomes measurement for the entire health and human service community in Louisville, Kentucky, in the mid-90s. And they, most of the community considers themselves victims of my perpetrating.
Really?
Yeah, that will be my epitaph, I'm afraid. But we did hundreds of trainings, literally hundreds of trainings, to help a community understand that, one, they needed to start with naming what result they would like to see as a result of their efforts, and then talk about what would be evidence that that result was occurring, and then talk about how what they've been doing contributes or not to that result, and whether it's necessary and sufficient to produce those results. And we phased that in over a number of years, and we held everybody harmless over that amount over those years. And what we found out at the end was that if we treat people like adults and we don't make it high stakes, that we focus on learning and improvement rather than punitive or forcing them, that a lot of them will get on board because they want to do the best job they can do. But what we found out as a funder was we were getting very niche outcomes specified by the programs, so that even if they achieved them, they were not terribly significant in and of themselves, and they were not very strong contributors for their missions. So we went back and we started asking, well, what's the most significant effect of what you do? Instead of, so it doesn't have to be a strict logic model. And that opened it up a little bit. But even so, most of what our funders and their vision and mission statements were focused on was creating population level change and systems level change rather than client level change. And that's completely different endeavor than program development, program implementation, program outcomes measurement. And you don't ask the same questions, and you don't
Howard,
start.
yeah. Howard, the one of the main purposes of bringing complexity theory to what I'm thinking about is I call outcomes little o and big O. And a little o outcome is one in which the objective is very narrow. And I'll give an example, which is a doctor outcome may be, I want to diagnose the patient and give them the right medication. But the big O outcome is, does the patient get better? So if the patient doesn't take his medicine and nobody's supporting the patient or nobody follows up with the patient, then the little o got accomplished, but the big O didn't get accomplished. And the big O is a system problem, where the little o is a component problem. If I go out and I buy coffee, my objective might be to get the lowest price, but in doing so, I might be buying coffee from slave traders or from people who are exploiting the environment, et cetera. So I'm not sure that I've accomplished the big O.
Right.
So I think you're saying the same thing. Am I right about that? It's a system problem.
It turns out to be perverse. I work with a group of funders and volunteers who are initiating an early childhood program. And at one point, they were coming down to specifying their outcomes and their values voting, and we were facilitating like crazy with them. And they chose prenatal doctor visits as being a more important outcome than delivering healthy babies. I mean, I found that terribly perverse. They specified an activity as more important than, approaching their mission in a sense. So, yeah. So when you get to the idea of complexity being a dynamic complexity, an emergent complexity, and a social complexity that are not amenable to logic models, the way most of us have been taught to do them, then you're starting with a different endeavor than most program outcomes measurement. I'm going to mute myself. I've talked too much.
Thank you, Howard. You really helped. Cheyenne, I'd love to hear from you. You want to unmute? I don't know. Cheyenne, can you hear me? Okay. How about Connie?
Okay.
I just unmuted Cheyenne.
Okay. I'll get to Cheyenne next, Connie. What are your comments?
Okay. So when I first learned about Mark's pop-up, I was thinking about the management in a university setting for the question of, is there a way that we can open up the walls of a university to be more community-based? And when I applied for this funding to do this, I had to come up with a model, a management model. And I had been working on one, but at the time I didn't know about complexity science. But in hindsight, when I finally discovered complexity, I realized that I had developed a management system for that was based on complexity principles. And so I think this endeavor might fit well if I told my story of what those principles are and how I implemented them, and then realized that they were all complexity principles of self-organizing and emergence and so forth, and complex adaptive systems and so forth.
So
anyway.
You could apply what you experienced like me.
Yeah, I really resonate with what you're saying, because I was struggling. I started on this management approach actually in the late 80s, when I was asked to come and deliver child welfare services to a newly emerging Indian organization on child welfare. And when they asked me to come, I refused to go because I said, I don't know really anything about Indians, and I don't really think I know much about child welfare. So why in the world do you want me? And they persisted for about 6 months. And finally I said, okay, I'll come, but you have to teach me about what you want for the welfare of your children. In other words, how do you want your children to learn or how do you want your communities to be better or well-being? And so I stayed with them for 2 years, coming once a month, driving 3.5 hours to get to their community. And at first they challenged me, absolutely challenged me. She's really going to go into this authoritarian mode, and she's going to tell me exactly what I need to do for the welfare of my children. And of course I didn't. And through this patience on my part, and listening all the time to this one fellow who was an elder in the group, and he kept talking and I kept saying, like, I've heard this before. And eventually one night I was driving back home through this horrific snowstorm where the snow was just coming right at the windshield. And all at once I knew what he was saying. And I went, oh my gosh. And after that, this whole partnership model just came tumbling out of my head. And so they were the beginning, but I still was meandering around. I went to a couple conferences and I presented on social constructionism, and I said, I am not social constructionism. I deleted postmodernism. Absolutely, I am not that. And so I started picking up physics books and reading about chaos. And then the light bulbs sort of began to go on. And then I stumbled onto Santa Fe Institute. And so by the time I got to this, I got a $1 million grant from the J.W. McConnell Family Foundation to answer the question of, can we open up the walls of university to the community? And by that time, I at least could articulate the model. But I still didn't know that it was complexity for sure. And so that's kind of my story. I don't know if anybody wants to react to it. I can go on and on. I get pretty enthusiastic about it.
Well, it sounds like you have a really powerful story you can tell.
I hope so. It is in, yeah, go ahead.
Amanda, I'd like to hear from you about the other aspect of my question, which is ways of making this alive, not necessarily just a book.
Yeah, and I you know, and Connie, I love your story, and Howard's too. I wonder if our answer to that almost isn't in the stories themselves somehow, in terms of if we really sort of listen in to what these different stories are about, if there isn't a way that the book can be not like a book. And books are amazing, right? I've read books that have changed my mind, that have made me start baking bread, that have completely changed my perspective or given me a new one. And yet I hear what you're saying is, how can we make this a book? And so I'm still formulating some of my thoughts on that, but essentially I almost wonder if, as if we're to step through and look at stories and their principles, if we didn't actually sort of include not just principles, but the different activities that people used within their stories that people could then use. And so, for instance, maybe Connie would be interested in sharing her model, or Howard in, including some of the specific questions that they use throughout their story. And so really not only making it this book, but also like a slight, I don't want to say toolbook, I don't want to say manual, possibility for turning this piece into a bigger engagement of actually experience as well as a reading experience, if that makes sense.
Talk a little bit more about what you mean by experience. You mean emotionally connecting or
Yeah, I mean, part emotionally connecting, but then also, for us to have this conversation and start to understand, you mean this, I mean this, are we understanding each other or not? I don't know, but I could actually, if you tell me the story and you give me more details as would happen as I'm imagining might happen in this quote unquote book, and I'm going to call it for now, then, I have this story, I have this little bit of context of how you have used these principles or this particular exercise or these particular questions, but then I have them laid out in a way so that I could also use them in my work when I'm facilitating a visual communication workshop or a yada, 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 right? My team at work isn't doing really well, and we keep getting together for this terrible meeting, and I'm really bored with it, and I'm not quite the leader I don't want to, but maybe if I just hand these couple questions to whoever that leader is, something a little different might happen. I don't know. I'm coming up with some different ideas, but Barb, do you have something to add?
No, not at this point. Oh, Barb.
Oh, Barb, sorry.
What I'm hearing as you talk is sort of a combination between the learning organization, the Fifth Discipline Field Guide, and also the Liberating Structures book. And as this conversation began, I just kept thinking, okay, well, how is this different than design thinking? And I think Loretta added in, this sounds like appreciative inquiry. But I think we really are doing something different than design thinking. It feels a lot more dynamic and responsive, and so that it would be a really exciting project to look at the tools and capacities of who we are and think about, how do we do this? Because it is different than design thinking, but if we just are telling stories of outcome management, it doesn't really sound all that different than what's happened in the past.
I agree with Barbara. This is Loretta. The big differences I see are context. When we were reading Sengi's books, all of the work was taking place in organizations where they were so heavily focused on looking at the research underlying frames for what made things possible. And I mean, I just come off a week that I spent with the American Hospital Association, where we're looking at creating healthy environments for patients in psychiatric and rehabilitation hospitals where outcomes have no measures right now. I mean, that's what makes this so exciting to me, is that we keep on looking to be able to make things better, and there are no standards or criteria. It's no one knows what to look at going in, so we have no idea what we're getting coming out. It's just better in some amorphous kind of a way. And so when we go back to what Sengi was talking about, there are some valuable pieces. I mean, action learning is the underlying piece, and a lot of that has some relationship to Six Sigma. So I think that we have, over the intervening years, and it's been, more about 20 years since we all started down this road, started to say, oh, okay, what happens if you don't make a one-time decision about whether or not we have a certain amount of criteria, and we're going to reach them to a certain degree. And when we reach that, we'll say we're done. We know this is a continuous process, and I think that's what makes the possibility of a book really exciting.
For me, I think the critical opportunity is in identifying the big questions and structuring around those questions. And in terms of my hierarchy of structure, it would start with the big questions, and then it would be, what are the principles that apply to the big questions, and then what stories can we tell about people encountering those big questions, and the lowest level would be the tools.
So Howard, I agree with that. I just had a different order.
Mm-hmm.
I think people like to hear stories first, rather than starting out with that. And within the story, so our big question was, why is the accident rate so big in Alaska for planes 5 times more than in the US? And what can we do about it?
So what's the question?
The question is, what can we do about it?
Yeah, I mean, so you just, those, why and what are exactly the first two questions, in my opinion.
Yeah.
I think putting that as the chapter heading and then opening the chapter with the story is fine.
Okay, that's exactly what I was saying. Hey, Sonali, since you are up at 2 a.m. or whenever it is now, I would love to hear from you.
Hello, hi everybody. I've been listening in and I've been typing all the thoughts that have come to mind. So I'd just like to reflect on what others have said so far. So Howard, you said something about when we let people, exercise their agency, they end up doing very specific things, and it's not very clear from a project or program management perspective what those add up to. So this was very helpful to me because this is the situation I'm in right now. So if there is any story which shows the transition from that stage or a way in which that way of working was able to align towards a larger more defined goal, that sort of a story would be very, very helpful. Yeah, that was a thought. Okay, I think I've said enough so I think I'll just
I'd like to ask you a question. I'd like to ask you a question. Are you involved in a project that is trying to achieve some kind of outcome and trying to utilize some of the principles of complexity management?
So I'm in a very strange situation. So my journey started like about 10 years ago, right out of med school. And I was doing my medical internship. And never read about, improvement or anything related to management, nothing at all. And so in my internship, I'm just observing, random chaos all around me. I was in a public hospital in India, very busy. And so I started reading about things and then went to do my MPH, thought I'll do quality improvement. And sometime during my MPH, I read some books, Black Swan, then somebody suggested Peter Senge, and then this whole world opened to me, and then I came across Plexus. So superficially, I have been doing quality improvement for the last 5-6 years. But a lot of it now is evolving into sort of catalyzing, so I came back to India because that was my initial motivation. And right now, I am sort of housed as an external consultant at one of the public hospitals here. And there are about 30 people who sort of have understood the basics of quality improvement voluntarily. And they're interested in it. We're very, very far from using this language that we are using on the call today and, talking in terms of liberating structures or other things. It's like, it's very, very nascent, where I am is right now is like, so how do I get other departments, people from other departments involved in, like, say, doing an improvement project? So right now we're at a stage where we're trying to even just people to think in terms of, like, it's not just about structure, or it's not just about blaming people. You have to look at the process, change the environment, etc., etc. So yes, in a sense, I am personally involved in trying to engage people, but the organization is very far from having these conversations.
Well, I got to give you some encouragement. I told you how our organization, and you wouldn't recognize it from what it was, but it took us about 3 or 4 years before, you could be beginning to see the noticeable change. And one of the interesting phenomenon was that we used to be an all-male practically organization. Now, 25 years later, we're I would say more than 50% female with, high level of female management. So it was interesting that I think that was an aspect of the revolutionary change.
Oh, that's interesting.
I just wanted to let you know that this transformation is generally, my experience, a longer-term process.
Mm-hmm. Thank you. And I just got an idea for another pop-up, but I'll save that for the end.
Okay. Okay, let's hear some other voices. Oh, come on. Susan.
Hello.
Hello.
How are you?
I'm good. I'm excited by the responses.
Oh, awesome. Well, I am a newbie here, and kind of got here by an interesting path, but I'll share with you, and also I was unfortunately late. I thought this started at 1:30, but if you could, you may have to enlighten me in terms of how I'm defining outcomes, but I've been trained under a organizational psychologist in leading a leadership team design, and the way he has described outcomes is what is happening in the here and now versus, as traditional strategic planning focuses on, what's got to happen in the future and let's track it, but in getting around the here and now, which is more present based, is that off course, or is that in line with when you talk about outcomes?
Let me share what I explained. oftentimes outcomes are defined in narrow parameters. And I give this example of a doctor who diagnoses a patient's illness and prescribes a drug, and the doctor feels like he's fulfilled his outcome. But if the outcome is the patient is going to get better, then the doctor has to be part of a system. And the system has to ensure that the patient's taking the medicine, that the patient understands what the medicine's supposed to be. So if the outcome is the patient's getting better, it's a system outcome. Now, that doesn't mean that the doctor has to go to the patient's house, but each person in that system has to ask the question, am I contributing to the outcome? And if I can't do it myself, is somebody else?
Yes.
So that leads us to complexity management, because what it says is we can't compartmentalize each of these things into the fragmented little pieces.
Right. And in other words, it's about it's really a linguistics thing in terms of how we conceptualize what has to happen all along the way.
That's correct.
Okay.
So in my company, we created an outcome manager, and an outcome manager had to define the system-wide outcome. And that manager was not just responsible for making sure that our company did its part, but tried to create alliances with other groups that would make sure that whatever we did had an effective role. And if we couldn't achieve that, we actually were supposed to give up the job. In other words, if we felt that our work was not going to be effective. So that was what we call big outcome. And what I realized, this is a very complicated way of managing, and it requires a different form of management than what's typically done.
Well, maybe the way it's being done is far more difficult than focusing on what we're supposed to do in the here and now.
Yes. Yeah.
Okay.
Well, the here and now means, I can't assume that everybody's going to be different in the future and they're all going to accept my great ideas. It means that I have to deal with what's real now. And the here and now is that. So that's.
Yes.
Cheryl, I'd love to hear from you. Cheryl Green. Okay, how about Rich? Okay, how about somebody else? Jennifer.
Hi, just unmuted, so hopefully you can hear me. Yes, did the unmute work?
Yes, it did.
Okay, so as I just typed in the comment box a minute ago, I was echoing Barb's earlier comment about referencing the work of Michael Quinn Patten, who has been featured through some prior Plexus calls and conversations. I come from the field of evaluation, as does Michael, so I have the benefit of continuing to learn from and interact with him at conferences and other convenings.
What's his name again?
Michael Quinn, Quinn, Patten, Patton. Okay. And he has really been leading the charge in the field of evaluation on looking at, how do we as evaluators operate appropriately, thoughtfully in complex environments. So as many of you were speaking, I couldn't help but think of, not only his earlier book on developmental evaluation, but he's done a couple of follow-up subsequent books. He's prolific. One being Developmental Evaluation Exemplars. And so it seems to me like that would be an interesting publication to take a look at, because that's, telling in individual chapters the stories, akin to what you were outlining, Mark, the stories of exemplary evaluations that were done in this way of complex initiatives. And what I think is intriguing about what you are proposing is that it's the stories of managing thoughtfully, effectively, appropriately in complex situations. So I would think it could be a really interesting kind of complement to that work that he has done. He also, one of his most recent books is Principles Focused Evaluation. So there's probably some fodder in there as well. That's hot off the press. So anyway, but I just think even from a, looking at from a structural standpoint, the way you were outlining the idea of having the individual stories, and then as the case with so many edited volumes, they extracted from across this set of stories the principles of developmental evaluation. And so it sounds to me like, you're proposing a very similar structure. So I mentioned that in the spirit of both the content and the structure of that publication as potentially providing food for thought.
Hey, Jennifer, could you write down in the chat section the name of the book? And
yes, so I've put some in there, and I know you can't read all of it as you're, facilitating this conversation, but yes, you'll see that in the chat section, several comments back.
Oh, great. Okay, well, we're going to be wrapping up soon. So first of all, I'd like to hear from each of you whether this is something you want to participate in. So let me start with Barb. Muted.
Yeah. Yes, theoretically. I mean, I think that it's still developing, but I think that this idea has already evolved from where it was originally. And yes, so in general, I'm still on board, and I can join with Amanda on the illustrations, trying to think about how we develop the illustrations, and also even sort of thinking about the structure of the book as a visual object. And I don't mean just the graphic design. I think about, how do you break it up in terms of, are there stories and sidebars? Are there questions and stories? All of that is kind of a design question that is somewhat editing and somewhat visual.
Yes, thanks. Jennifer?
I'm unmuting here. So yes, I just dove into this conversation today without any prior background information. So I feel like I'm scrambling to catch up to where some of you are at. I'd be happy to stay engaged in the conversation and see where it goes. I find it intriguing. So I'd like to stay engaged.
Okay. Howard?
I think so, sure. I'm not sure what the this is, but I think that's a way to continue the conversation.
I would love to hear, I'd love for you to write about your story, because it sounds like you really have a lot to share.
Yeah, I mean, but that's the least interesting or helpful piece. That's kind of like the sad story. I mean, where we've succeeded with using complexity principles in various broader inquiries, I think is a lot more valuable.
Okay. Amanda?
Yeah, I'd like to make a process suggestion too. I know there are a bunch of folks who are in other meetings or doing other things and can't necessarily speak. So I'm going to go out there and ask them if you have sort of stuff to put out there, to throw it in the chat for sure. That answers sort of Mark's question on, how you might want to be involved. And yeah, I mean, I see it as emerging. To echo what other folks have said, I don't know what the exact this is yet. But that's the fun of it, right? We have a Swiss cheese goal.
Yes, exactly.
So.
And also, please remember to put your email, if you haven't done it already, put your name and email so that, I'll have an ability to contact each of you.
Yep, into
Connie,
the chat.
It seems like you already said you were interested.
Hi, yeah, I would like to, again, stay engaged, join the calls, and wherever I see I can fit in, I will I will let you know.
Susan.
So this is very, very useful for me personally in terms of learning. So I'm very interested. Thank you.
Great. Susan?
Yes.
Oh, great.
Can you hear me?
Yeah.
Yes. I'm sorry.
Yes, I can.
Yes.
You have stories? Oh, I think you do. You have stories
Oh,
that
yes.
might really help. Okay.
Yeah, I've got stories.
I'm not exactly sure. I think stories are an element of this. And what I'm hearing is stories is an element, but how we structure the stories with the principles, we're all going to have to work some of that out. What's going to happen is we're not going to have that many more pop-ups on this. Probably maybe we're going to have working project sessions. So, once I get a list of people who are interested, we'll have project sections. Cheryl.
You didn't hear from Susan.
Oh,
Where is Susan?
yes. So is there a
I thought I did. I'm sorry.
So is there a platform?
I thought it was Susan. Is there what?
Is there a platform that you prefer to use? Slack or some type of collaboration tool?
I'm going to have to, we're going to meet on a Zoom, and then people are going to recommend that to me because I'm not that knowledgeable about the collaboration tools.
Okay.
And so that's something we're going to have to figure out as a team.
Okay, good.
Okay. But so what we'll be doing is maybe that's one of the couple of first things we'll do is to work out a process. How do we collaborate? Where do we put it? And the first meeting will be, because it's going to take several meetings before we even get this thing defined. And in good complexity theory, we may get down the path and decide something different's going to emerge. So, I think I'm not wedded to, I have ideas, but I'm not wedded to, we write a chapter with this and that. I have a chapter that I wrote, but it's open for change.
So here's a suggestion. Why don't we each submit outcomes that relate to this and to the project, and that may be a place to start in terms of applying what you're talking about.
I think that's an excellent suggestion. Maybe what I can do is raise once the project gets formed, I can raise some questions and send it out by email.
Yeah.
And then get that, summarize it for people, and then send it back.
Yeah.
But there's a lot to think about in terms of starting a project. But this is the first Catalyst project we're starting in the new era. So we're going to be learning.
Yes. I'm a member of an association called the Business Architecture Guild, and they actually they've used the power of crowds, much like what you're talking about, to create a learning tool for how business architects help organizations. So there is a little bit of crossover here that maybe I can share, because they've got a lot of frameworks to use along these lines.
Well, as somebody mentioned in the chat, we also have, Plexus has a Google Docs section.
Oh, good.
So that's a possibility also.
Awesome.
Cheryl? Rich? Denise, are you still there?
I am still here. I'm trying to be the silent typing person on the wall.
Now it's time for you to talk because you've listened to all this.
Oh no, I think this is unbelievable. So yes, I will. I'm happy to just sort of not conclude, but just to say, wow, this is tremendous. And I've been sending messages publicly and privately, I think, to everybody. Thank you for everybody. Thank you to everybody, and understand that some of you were unable to speak, but really a lot of energy coming out of this. So please feel free to send to Mark or to admin@plexusinstitute.org any comments. We can definitely use Google Docs. We will post this recording for people to look at. Make sure you do put your email in here so that we can start to develop the list. And Mark, this is terrific and wonderful, and to think how far it's gone just from the initial idea. I do want to mention that, Howard, I'm going to tip my hat because I think that everybody has things to contribute to the project that may go beyond just a story. And so, you know, it's that multi-level scaling that happens with any complex project or complex issue that you're trying to address. And so, bravo. And I hope that each of you will think about, I may not be able to or want to, or my stories aren't particularly relevant at this point, but there's other things that can contribute to this. And, you know, we don't know what the end outcome will be, but the fact that we're all here means that there's a real need. And I know there are other people who were unable to attend who will be participating. So this is very cool. Mark and Plexus will follow up, and we'll probably move this into a Catalyst Project Circle so that that it has its own distinction. Meetings will be noted on the event calendar as distinct with the name of the project. And thank you, Mark. Thank you, everybody. Thank you. And Plexus Institute and Denise Easton are now going to mute themselves.
Okay. Loretta?
Yes, you can count me in. I'm not sure exactly where this is going to take me, but I think it's going to be wonderful.
Okay, well, this is exciting for me. We got 5 more minutes if anybody has anything else to add. If not, we'll adjourn the meeting. And Denise, I'll follow up with you.
What I would appreciate, and I guess I'm a slow learner in this respect, or I haven't heard the answer I'm looking for, is if this project is the answer, what was the big question? I mean, so what is our intention? How will the world be different if we're successful?
Let me share what I think, and we can.
Well, I'd like you to share it, and I'd also like to see you write it out.
Okay.
So we have it as kind of like, I mean, it's open to change and improvement, but it's a good platform to start on for me, at least.
So the outcome I have is to convince people who are in management that this way of thinking about outcomes and complexity produces positive results and requires a change in the way we operate together. It's not only a positive result in terms of where we end up, but it's a positive result for the individuals who actually get involved in this way of managing. So we had a much happier, much higher degree of individuals who were working in the company as when it came to measuring their satisfaction with the company after we made this change than before it. Not only that, as I was telling you early on, we didn't have any of our ideas accepted. By the time we made this transformation, we were having a huge number of our ideas accepted. And thirdly, we could actually measure real outcomes in terms of the accident rate in Alaska dropped by 50% in the test region that we had. So what I'm hoping from this book is that we can explain to people, not just through theoretical discussions of complexity management and different techniques and all that, but people can really experience it. When I used to meet with young people who were coming into the company and I would tell them the stories of what we did and how we changed, their eyes lit up. They felt invigorated. I'm hoping these stories will do that for people, as well as lay out the principles so that it touches them emotionally, and then we connect it to the intellectual ideas that have emerged. So that's the point, as far as I can tell.
Yeah, I appreciate all that. I think that there's actually a larger ground than that as well. I mean, that sounded like a how to me. how do we change people, and then why do we want to change people? What's in it for them is the preceding or the larger ground for me.
Well, what's in it for them is really much greater satisfaction.
Yeah, they need to tell us what's in it. I mean, we need a way to connect them in the here and now with the future they envision for their milieu.
Right.
Can I say something?
Sure.
So so I'm very much into something called flow theory, the Mihai Csikszentmihalyi, and so I don't know that it's about changing people. I think it's about changing the conversations that bring out the potential in people, because actually where we actually perform our best and we feel our best is always in the here and now. And that's why, that's why this particular forum excited me, because I think that people don't understand that so when you're playing music and you're skiing or when you're in the flow, it's always about in the here and now. It's not some goal that's that's out in front of us. It's what how do I experience it both in my mind but also my heart and soul. And and so creating, and that's where the complexity of the outcome statements really makes a huge difference, because everybody has to understand that. Everybody has, it's not something that's dictated, it's something that's created.
Absolutely. That is such a profoundly important statement. And this is where it all sprung from, in my view, is I had 39 out of 41 people working at high pitch effectiveness, and that came from their internal flow.
Yes.
It didn't come from more money. It didn't come from, it came from this sense of creativity that was just, and it was remarkable. I've never seen anything like it.
Yeah. Yeah. Fantastic.
Yeah. Okay. Amanda, did you have something to say?
I just want to echo what was just said. That it was brilliantly said. And just a thanks to Mark for bringing the idea forward and continuing to step into figuring out what this is going to be. Again, to sort of echo what Denise said too, I think there's definitely a whole bunch of different roles here, and I'm kind of excited to see what they are. And I think one of the questions that I'm holding a little bit is, who is the they that we keep talking about, and who exactly are we writing for or thinking about will actually use this book? Because that to me completely changes how I use it. Are we talking about teachers? Are we talking about management, which means a lot of different things to a lot of different people, I think, even. And so finding space to get clear on that might be another one of the first conversations that we have that makes a lot of sense. And so I will also be so bold as to just share the drawing that I did around what the big question is that Howard asked in the end. So
I can't quite read it, but maybe you can take a picture of it and put it in.
Yeah, I will. I will. So,
okay,
awesome.
everybody.
Yeah, thanks.
2 o'clock. I am very thrilled, and you've all really contributed a lot, and you'll be hearing more about this as a project. Okay?
Thanks.
Thank you.